Global COVID-19 death toll has risen to 2,97,197 and over 43.47 lakh people have been infected with coronavirus across the world. The COVID-19 death toll has reached 84,119 in the United States of America. Over 1.39 million people infected in US. Coronavirus has claimed 33,264 lives in UK. In Italy, the death toll has climbed to 31,106 and 27,077 people have died of COVID-19 in France. The COVID-19 death toll in Spain has reached 27,104. The COVID-19 death toll climbed to 7,861 in Germany, while 2,212 people succumbed to coronavirus in Russia. COVID-19 death toll stands at 4,637 in China. Over 6,783 people died of coronavirus in Iran. Let's go across to my colleague Ashish Parekh, who joins us live from the newsroom with more inputs on it. Well, Ashish, the situation seems to be getting worse with each passing day. United States of America continues to be the worst affected. Do we see silver lining anywhere?
Well, at the moment, given the fact that the death toll is inching closer to a grim milestone of 3 lakh, silver lining is something that seems to be a far distance. But having said that, one of the things that is very important to note is that most of the countries where you have the highest number of cases being reported every 24 hours, all of these countries are, while they are trying to make sure that they keep the pandemic under control, they are also making sure that they somehow ease the restrictions. That goes on to show how much of an economic crunch there is across the globe. And we're speaking about the United States, we are speaking about Russia. Both of these countries are finding out different ways to ease lockdowns and make sure that the economy is back on track, and they somehow go ahead with at least some sort of day-to-day operations and other production activities which would further strengthen their fight against COVID-19. And this also comes in the backdrop of a statement by WHO that has now created a stir across the world. If you remember, Dr. Mike Ryan from WHO, who is the director of emergency programs, he has gone ahead and said that this could possibly be an endemic. That means that this is a disease that instead of us trying to cure it, we need to find out ways that we can deal with it, preventive measures, and make sure that we continue our normal lives while also dealing with this pandemic which is COVID-19. He gave an example of how we have somehow tackled HIV. There is no vaccine for HIV, but still people are living longer, and the world has somehow gotten used to it and found a way around it and made sure that they somehow carry on with the day-to-day operations. That could possibly be a similar case with COVID-19. But are these two cases really comparable? The kind of infections that you have, a mere surface contact or some sort of sneezing and coughing is enough for COVID-19 to spread. So can we really compare these two diseases and somehow try to find a way around COVID-19 just like we have around HIV? That is something that a lot of people have been debating over the past few hours, ever since the statement by the WHO is out. But yes, one of the things that needs to be noted is that the world is now trying to get its economy back on track, get its day-to-day operations back on track. The fact that you had severe lockdowns in place all across the world, that has not stopped the COVID-19 cases from rising, and somewhere or the other the countries are somehow exhausted, not just economically but also probably given the fact that the cases are rising, they have somehow partially given up and have decided to find a way around this pandemic rather than focusing mainly on vaccine, because that is something that seems to be quite a distance away, given the fact that most of them are still not even into human trials. So this is something that needs to be dealt with. And meanwhile, what we are noticing is that the number of cases, the death toll, and the number of positive cases across the world are increasing every passing day and are showing no signs of slowing down.